I think in rare diseases, it's tantamount to have the patients and families be part of the very planning process for trials, and not come in later and look for their perspective after the trial has already been designed and planned. So having them be an active stakeholder and equal contributor also creates a certain ownership and builds trust and confidence of families in the upcoming trial. I think it increases compliance and retention in the trial. And also when things don't go as expected, it's a much better basis to then work with families to find solutions and a path forward. Particularly, I think if there's a funding shortfall or a sponsor drops out, these are very hard situations for families. And to know that they have been in the part of the whole process from the very beginning can help soften some of those setbacks. Plus, they can become advocates for some of the outcomes when there are discussions with FDA, and the patient testimony is very important for regulators. So I think on the same lines I was saying before, patients understand what's clinically meaningful to them and can help through their perspective and through their input make sure that the outcome measures of a trial are clinically meaningful and not simply quantifiable. So just because there's a scale that enumerates severity doesn't mean that a certain change is clinically meaningful. And so I think talking early on to patients and families about what is meaningful change to them can make a trial much more robust and powerful. Plus, looking at inclusion and exclusion criteria early on to understand whether the families are going to be willing to participate and whether there might be families who might be disappointed because they're excluded is also a very important part of the process. So I think those three things I would emphasize. I think having patients understand how physicians and scientists are thinking about the biology and thinking about trial design is important, but also in reverse, having people like Gael and Mother Marina speak up about her child's condition is tantamount, because we need to, as physicians and scientists, hear about the suffering that patients are going through, but also what the concrete trial experience was, and how can we improve trials moving forward, how can we accommodate things to make sure that the trial is also not an undue burden for patients in terms of day-to-day logistics. I think more than impacted, ELA has shaped the field. So I think ELA should be extremely proud of the fact that they have helped build the field of leukodystrophy research. Without ELA, we wouldn't be having many of the discussions around outcomes, biomarkers, trials, and even the basic pathophysiology of some of the rare diseases. ELA helped fund some of those early studies. So it's a critical force in the field, and something to be very proud of. So. I'm optimistic. I do think that there are lots of challenges. Now that we have options, I think the field has become more complicated, more dynamic, and we have to think about things on a very different level. I'm very happy that Gregoire is here as a bioethicist who's helping guide some of these discussions. But behind every opportunity, lies also a challenge. And sometimes progress brings inequity, and people who get access and people who do not get access. And sometimes, hopes are riding high, and then they're falling apart when the trial stops or has adverse events. And how do you, through all that process, help families feel supported and to give them a sense that there's still an ongoing path forward? So I think I am very optimistic about trials, but I think it's going to be a rocky road, and we're not always in control. And so having a community such as ELA is building is very important. And so I would continue to encourage ELA to reach out to all members and bring people together, and that will build confidence and trust, and that's what we need.